Where have all the ear infections gone? One way I knew my pediatrician was a good doctor was that he resolutely refused to diagnose an ear infection in my youngest child. My older son had had quite a few ear infections, and we'd gone through any number of bottles of amoxicillin, which, fortunately, he rather liked. My daughter had 1 or 2 ear infections. She hated all liquid medicine, and resisted it so successfully, with the spitting fountain approach, that the doctor once found dried amoxicillin in her ears, prompting some concerns about me as both a mother and a pediatrician. You do know she needs to take the medication by mouth? But not the youngest. Fever, cough, runny nose, cranky, it was always just a viral upper respiratory infection, with no evidence of infected fluid collecting behind the eardrum, no reason to treat with antibiotics. When I started practicing pediatrics in the 1990s, it seemed we diagnosed a case of otitis media, middle ear infection, every few minutes. I knew the antibiotic dosages by heart for children of every weight. I knew the risk factors for ear infections, daycare, exposure to parental smoking, not being breastfed. But risk factors or no, it seemed like most small children had ear infections, every now and then. Now in clinic, ear infections are much less common. When one of the residents gets ready to make this diagnosis, the supervising doctors sometimes get called in to verify, is the eardrum really red, bulging, not moving? If there's a buildup of infected fluid behind the drum, it bulges out, you blow a little air into the ear, and the eardrum doesn't move. In a study published in March in the journal Pediatrics, researchers tracked 367 babies during the first year of life, regularly swabbing their noses to see what viruses and bacteria had colonized them, and watching to see when, or if, they would get their first ear infections. 6% had a first ear infection by 3 months of age, 23% by 6 months, and 46% by a year. The babies who got ear infections had twice as many colds as the babies who didn't, reinforcing the relationship between viruses and the ear infections that can follow. They were also more likely to be colonized by bacteria that can cause infections. As in many past studies, breastfeeding lowered the risk, for both colds and ear infections.